am Dr. Nidhi Jain. I am an obstetrician and a gynecologist working in Artemis Hospital and Opulence Clinic, South City 1. Let's talk about contraception today. Contraception is a very important method of preventing unwanted pregnancies. It can be both a regular method of contraception as well as emergency contraception. Emergency contraception is basically used in cases of unprotected intercourse within 3 days in case of a pill, or within 5 days we can also insert an intrauterine contraceptive device. But we need to understand that emergency contraception has its side effects. The pill can lead to a problem in the next menstrual cycle, a delay in the regular menstrual cycle, or intermittent bleeding, which can lead to unnecessary apprehensions. And also, emergency contraception is not a regular method of contraception and it cannot be used every time. The patient needs to understand that they have to use a regular method of contraception. So, in the regular method of contraception, we have 4-5 options. First is a barrier method, which includes condoms. Next is the combined oral contraceptive pills, or the progesterone only pills, or many kind of pills are there. 4 generations of pills are there. Then intrauterine contraceptive devices as well as injectables. Barrier method of contraceptions are easy to use and easily available, but they have a high failure rate and they are user dependent. Oral combined contraceptive pills which we give are very good. They have a very low failure rate, but they need compliance. They need to be taken every day. And if the patient forgets to take the pill, then the effect can get haywire. So it's very important to be compliant with the pill. Third is the intrauterine contraceptive device. So copper T or hormone containing devices can be used, and they can be put by the gynecologist into the uterus after checking the patient, after doing some ultrasounds, after taking a proper history. And they can be really effective in preventing unwanted pregnancies. They don't need a regular compliance from the patient's side, because once they are put inside the uterus, the patient need not do anything about it actually, and they can just stay there for 3 to 5 to 10 years depending on the type of device which is being used. And the hormone containing intrauterine contraceptive device is even very helpful in bleeding issues. When the patients have heavy bleeding, they are even effective in those cases. So they can have an additional benefit. Coming to the injectables. The injectables can be given once in 3 months. The patients can use the injection, but they definitely have a problem of irregular bleeding. They can disturb the menstrual cycle, and they do have some failure rate. And of course, the patient needs to remember that every 3 months she has to take the injection. So every method has its side effects and benefits which need to be discussed with the doctor. And of course, every contraceptive method needs to be taken under the supervision of a doctor. They cannot be taken by the patients on their own, because the advantages and the disadvantages need to be discussed, and the type of method which is being used has to be patient-centric. It has to be based on the patient's demands, based on the patient's history, based on the patient profile. For more information, please subscribe to our channel and visit us on Instagram, and for any queries you can call us on the number. Thank you.